Hello, my name is Ravi. I'm from My Cancer Haven, and today we have with us one of the leading authorities in multiple myeloma in the United States, Dr. Natalie Callander, who's professor of medicine at the University of Wisconsin in Madison. And she's been one of the investigators who has been studying a novel CAR T, Anitocel, in relapsed refractory multiple myeloma. Welcome, Natalie.
Thank you very much. It's a pleasure to be here.
So, Natalie, can you just lay the background and tell us what is Anitocel? How does it
Yeah,
differ from the currently marketed CAR T cells?
that's a great question. So we have two CAR Ts that we can use right now commercially. One is Itocabtagene of Autoleuce, and one is Ciltacabtagene Autoleuce. And they have what are called a single chain variable region binding site for BCMA. In the case of Itocabtagene, that is a murine-derived binding site for BCMA, and in the case of Ciltacel, it's actually derived from a llama. And they both bind BCMA, the CAR T products bind BCMA well, but what Anitocel is the BCMA binding domain is this D domain. And the idea here is that it binds with very high efficiency, but it also does not do what's called tonic signaling. So what the heck is that? That's when one of these CAR Ts sort of binds to the BCMA receptor. It kind of doesn't let go. And there's some concern that actually that could lead to maybe the T cells not being as functional eventually, that they get exhausted. And there's also a consideration that maybe this kind of tonic signaling is responsible for some of the other side effects. And so we were very happy to be involved at the University of Wisconsin in Imagine-1 to look at this different CAR T construct.
So, what do we know about it to date? We're going to talk about the Imagine-1 study
Yes.
in a minute, but what do we know about it so far?
Right. So there was a phase 1 trial of Anitocel where it looked very promising. This came out of actually a lab in Boston initially, and they had treated about 30 patients and really saw both a very high response rate with about 79% of patients achieving a CR, and then the progression-free survival, kind of the top bar we're kind of used to seeing is with Ciltacabtagene, which is right around 3 years. And so this was very comparable in this small phase 1 study.
So, what was the Imagine-1 study?
So the Imagine-1 study was a multi-institution study designed for individuals with relapsed multiple myeloma who had had at least 3 lines of therapy, and they had to have been exposed to an IMiD drug, meaning either lenalidomide or possibly pomalidomide, a proteasome inhibitor such as